Good evening, it's Dr. of Mine. Here's some tips if you're taking Citalopram. First of all, it's a weak SSRI, so you gotta be careful that it's gonna lack efficacy. But assuming it's for the right indication and you're being prescribed it, here are some things to monitor. Initially, you could have nausea and diarrhea, which stops after a couple doses. Some anxiety, irritability, agitation, which hopefully will wear off. But if that gets worse, you gotta tell your doctor right away, because that could lead as one mechanism to increase suicidality, for example. Then you gotta worry about sweating, teeth grinding, headaches, restlessness. Those are possibly dose dependent as the doses increase, so sometimes if you lower the dose under the doctor's supervision, that could be fixed. Other things include sexual dysfunction, insomnia, headaches, it won't go away, bad GI or gastrointestinal symptoms, it won't go away. These are things you have to consider and talk to your doctor about. Now, in some patients, it could make you tired, in which case you could take it at night, but generally it's supposed to be somewhat stimulating and you take in the morning with toast, not on an empty stomach. If you have some side effects, some are reversible. There's little tricks you can do for the sexual dysfunction, for example. You gotta be careful, because even though it's an SSRI, there are reports of overdose in Europe on a month's supply. The maximum dose of citalopram is 60, so you can't double the 40s. That exceeds the FDA max and would possibly contribute to serotonin syndrome. See my video on that dangerous side effect of SSRIs. I don't recommend ED meds to counteract the sexual dysfunction. I use things like bupropion augmentation in special cases. Now, some of the good effects are it should decrease depression, anxiety, obsessions. The bleeding is a little bit overrated, but there are serotonin receptors on the platelets, which can make SSRIs more prone to be associated with bleeding, especially if you're taking other anti-platelet aggregating meds like Plavix or just aspirin. Or say you're bleeding from something, the SSRI can make that worse, but I would worry more about agitation and insomnia, anxiety. What you don't want to do is start popping Xanax because you're getting activated off of citalopram. That's not a good sign. Generally, you can lower the dose. Now, you probably have tried other stronger SSRIs first. However, it is a good one to introduce when you're also psychotic or depressed, because it's not as activating as some of the SNRIs or NRIs. You gotta be careful mixing other meds. Atypical antipsychotics generally mix well, so do mood stabilizers, and benzos and some sleep aids. But you don't take an SNRI with an SSRI like citalopram. So if you're on Cymbalta or Effexor and citalopram, something's wrong. I also don't like mixing stimulants. You'll see a lot of Adderall and Celexa. I don't quite understand that rationale. Medical meds that mix well with it are most. You do have to watch for some things, but generally speaking, the SSRIs are safe in someone with heart disease, hypertension, cardiovascular disease because they don't mess with your blood pressure and pulse like, say, bupropion, or maybe some of the SNRIs. So just review the medications, the medical meds you're on. So as far as drug and alcohol abuse with citalopram, I don't recommend it. It not only can inactivate it, but can enhance, and you could get a bad reaction, like citalopram plus cocaine plus testosterone and ephedrine. No wonder why you're going to get homicidal. So these are some tips on taking citalopram. If you run out, you generally don't crash into a suicidal depression quickly like you do with, say, venlafaxine or other more potent SSRIs with short half-lives like paroxetine. If ultimately you've tried every SSRI except citalopram and you're still sick off of citalopram, I would consider lamotrigine, unfortunately, as a third kind of choice. I'm having some initial good results in patients who can't tolerate SSRIs. Thank you. Good luck with your citalopram. Oh, a couple other things. An excess citalopram or early serotonin syndrome can be treated mildly with diphenhydramine or in more severe cases with the benzo. So if you're really agitated, sweaty, nervous, suicidal, anxious, you gotta go back to the doctor and get that checked right away. Thank you.